what are you going to do in an emergency? This is every parent's worst nightmare, but I'm glad that you're here today. My name's Dr. Candice, and welcome to the Baby BFF. Today, I want to talk about what to do if you find your baby unresponsive and in an emergency situation. This is not going to be a CPR class that's going to certify you in infant CPR. However, this has really been on my mind as something that is really important to get out to new moms, new dads, grandparents, and really anybody that is taking care of an infant. So let's go ahead and get started. What we're going to talk about today is what to do if we found our baby unresponsive. So imagine, let's just talk about a scenario that you walked in and you found that your baby looked very gray, they weren't moving, they appeared to not be breathing. What would you do? Infant CPR. So let's go ahead and get started. The first thing that you want to do when you walk in and you find a baby that you believe to be unresponsive is you need to make sure that what you think that you're seeing is actually happening. So the first step is you are going to try to arouse your baby and see if you get a response. Baby, are you okay? Baby, are you okay? It looks like my baby's not breathing. So at this point, what you're going to want to do is you're going to want to look, see if you see any breathing movements, if you can get your baby to respond to you. Again, do not shake your baby. That's going to cause other issues. Okay, so baby, are you okay? We're going to look and see, is our baby breathing or not? No, my baby's not breathing. At this point, if your baby is not breathing and non-responsive, this is the point that you need to start CPR immediately. What I'm going to tell you is that you are not going to hurt your baby by doing CPR. Even if you think maybe you might not be doing it 100% correctly, if they're in the situation and they are not breathing and they are not responding, you need to act quickly. Unfortunately, a lot of the times people think, oh, well, what if I'm not doing CPR correctly? At this point, your baby needs help. So please go ahead and start CPR. And I promise you, you will do what you need to do after watching this video. Okay? So again, baby, are you okay? Our baby is not responding. At this point, we need to start compressions immediately. So to do compressions on a baby, there's really two ways you can put your hands. You encircle the chest. I'm actually going to hold my baby up so that you can see what this looks like. Do you see I'm kind of grabbing underneath their armpits and I am putting my two fingers, if you feel right here on yourself, like right between this little breastbone here, that's where you want to put your fingers. Right between their nipples is the best spot. Okay, you're going to put your fingers there. Or another way that you can utilize your finger placement is you're going to use two fingers, and again, right between that nipple line, right here on your baby. Okay, so when we do compressions on our baby, we are going to do 30 compressions and then 2 breaths, okay? Again, 30 compressions and then 2 breaths. But I do want to talk about what compressions are doing and why you need to start it right away. So compressions are actually going to allow the heart to be able to take blood around the body and help to perfuse the organs, which will prevent any further brain damage, organ damage, and heart damage. Again, we're gonna, baby, are you okay? Our baby is not responding. Our baby's not breathing. You can try to check the pulse, which is usually here, a brachial pulse on a baby. Again, if your baby's not responding and not breathing, they're not going to have a pulse. You need to act now, okay? So, 30 compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And at this point, we will have to give 2 breaths, but I want to talk really quick about compressions and how fast you need to go. So you can think of that song, staying alive, staying alive. I know it's not really a good rendition, but that's just something that you can use for a beat to be able to do your compressions. Also, remember, babies' heart rates are really, really fast. A newborn heart rate, on average is about 140 beats per minute, which is way faster than an adult. So it's important that we compress quickly. When we're compressing, you also want to make sure that you let your hands recoil. And the reason for that is because every single time we push down, we're pushing all the blood out to the rest of the body. And when we let our hands come up, you want to let that heart refill with blood so that when you push down again, that there will be blood in there to perfuse the body or to take all the oxygen to all the tissues. Okay, so I'm just telling you the why behind it so that you kind of understand what's going on and why you're doing it. All right, so we'll do the 30 compressions, and then next we're gonna go ahead and we're gonna give 2 breaths. All right, so with infants, what you are going to do is you are going to use your mouth and you are going to cover their entire nose and their mouth, and you will give 2 breaths. When you give the breaths, you are looking to see if your baby is getting chest rise, all right? So when you give the breaths, you should kind of see their chest rise up, chest rise up. Now, remember, this is a baby. Their lungs are a lot smaller than yours. So that's something to think about as well, is that you do not need to give your entire lung capacity into your baby, all right? That's not going to be helpful. So all you need to do is you need to give enough air to be able to bring that chest to rise. And usually it's 2 small puffs. So I'll show you what that looks like. And as you can see, my baby was able to get chest rise. I'm going to show you what the sequence of CPR looks like, and then you can go ahead and you can grab a pillow or something off your couch and practice this, because remember, practice does make perfect. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Now, remember, you would need to keep going with CPR until your baby becomes responsive and until they start breathing on their own. Some other things to consider is calling for help. As soon as you find your baby in this sort of position, you are going to need to call for help. Remember though, we want to make sure we are getting all of that blood and oxygen to our baby's brain. So if you are by yourself, you really need to start CPR, and hopefully you have your cell phone there with you. You can do those little 3 clicks on the side and it will call 911, but you really need to start CPR first and then call for help. You do not want to be standing here waiting around trying to tell 911 what's going on without starting CPR. So the important thing to do, again, start CPR early. Start it as soon as you notice a baby that is non-responsive, and make sure that you call for help, because your baby will need to be transferred via ambulance to the hospital so that they can be further assessed. I hope that this helps you. I will tell you that this is very, very rare, and likely in your life you will never have to do this, but I do not want you to be unprepared. I do encourage you to go take an infant CPR class in your local community, and I hope that this helps you. Thanks so much for joining me today. I'm your baby BFF, Dr. Candice.